afternoon and welcome to Around the Tiers. I'm Steph Stoiko. Coming up, this week's financial tip with RJ Barber. But first, November is Lung Cancer Awareness Month, and joining me now in studio to shine a light on lung cancer are Dr. Junaid Khan and a lung cancer navigator, Emily Post. Thank you both so much for joining me this afternoon. And as I said, November is Lung Cancer Awareness Month, and can you tell us about that?
Thank you, Stephanie. So lung cancer is one of the most common cancers in the world, and lung cancer deaths account for most cancer deaths globally. If you look at the data recently, globally there's about 1.8 million lung cancers that are diagnosed and 1.6 million deaths reported. So the rate of cancer death from lung cancer is very high. Now, this 5-year survival for lung cancer is about 18%. You compare that to other common cancers like breast cancer is 90%, colon cancer is 65%, and prostate cancer is 100%. So there's a big discrepancy in how lung cancer is so common and it kills so many people. That's where we know that the other common cancers, they have a established screening tool that has been used and that has shown good results, where up till the last 10 years there was a lack in a good screening tool for lung cancer. In 2010 they came up with the lung cancer screening guidelines that have shown that if you do a regular CT scan in a high risk population, defined in those guidelines as people who have smoked for more than 30 years, who are more than 55 years of age, and who have a 15-pack, who have quit in less than 15 years. They found that there was a 20% decrease in mortality with just a single low-dose CT scan in a year. Since then, they have updated the guidelines, and they're now including people who have a 20-pack smoking history, which means they have smoked a pack a day for 20 years, who are 50 years of age. So they are also including people who have had other environmental exposures or chemical exposures, or who are on who have COPD or high risk of lung disease in this group. This is where the lung cancer screening program that we have at Lord's comes in, where we're offering the low-dose CT scans once a year to hopefully help the community in avoiding a disease that is potentially curable, as compared to having a really high mortality, which we have seen right now.
And can you tell us a little bit about those screenings that Lord's offers?
Sure. So the lung cancer screening program is where we work collaboratively together. We come in, if you're part of the program or are high risk, you come in for an interview with one of our navigators, Paula or myself, and we kind of go through some questions with you to make sure that you do, it's appropriate to do the CT, and we kind of like to say it's one-stop shopping. Yep. Make it easy, because I think at this day and age we're all very busy. So come in, you meet with us, we make sure that you qualify, you meet with a doctor, and then we take you right down to the CT, get the CT done, and then a follow-up visit to make sure we review the CT results. We also make sure that we keep it easy and we follow you, so when you're due for your screening in a year, we're contacting you or sending you a reminder letter, just to make sure all the other, like he was saying, Dr. Khan was saying, the other screening programs like prostate, our mammograms, making sure that this part is, that the lung cancer screening is another screening that we do. So if anybody's interested, it's 798-LUNG here at Lord's. 798-LUNG is the number to call, but also talk to your primary. Our primary care providers are very well versed in those screenings, and they can refer too.
And very quickly, can you tell us about this Shine a Light campaign?
Okay, because November is Lung Cancer Awareness Month. Every year we do an event along shining a light on lung cancer, and we bring survivors in to talk, and we raise awareness, give us statistics, and really shining a light. We actually shine a light and take a moment of to recognize lung cancer. This year with COVID and last year with COVID, we were unable to do that. So this year we're trying to do events like this, social media, raising awareness through the social media, but also any pulmonary patients that are coming in this month, we have a nice little grab bag with some cancer statistics in it, and lung cancer screening information.
Well, thank you both so much for joining me this afternoon. I will get some more specific details to you now. Lung Cancer Awareness Month is an annual observance held throughout the month of November. Our Lady of Lourdes Memorial Hospital is taking part in this year's month-long Shine a Light event to raise awareness and promote the importance of early screenings. Shine a Light is part of a national campaign to raise awareness for lung cancer and to offer hope, inspiration, support, and remembrance for those touched by the disease. To make an appointment or to speak with a specialist, you can visit the website or call using the number